Haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Ependyoma. Then we'll be looking at the medulloblastoma and also the blastoma as well as the pilocytic astrocytoma. Pilocytic astrocytoma. So now let's begin the ependyoma. Ependyoma, it commonly occurs in the posterior fossa. So ependyoma occurs in the posterior fossa. It shows a drop metastasis. So there is a posterior fossa showing the drop metastasis. There is presence of the prophylactic craniospinal irradiation. So there is a prophylactic craniospinal irradiation. So this will be administered. Then comes the ependymyoma. This is related in the ependyoma. It is related to the floor of the fourth ventricle as well as the foraminal extension. So floor of the fourth ventricle as well as the foraminal extension. Next, we will move on to the medulloblastoma. So here in the medulloblastoma, it is related to the roof of the fourth ventricle, and there is a hypercellular tumor. It is a hypercellular tumor. There is presence of the hyperdense on CT. It is hyperdense, and this will be present on CT. There is a restricted diffusion on the DWI. There is restricted diffusion. This will be present on the DWI. Now let's move on to the pilocytic astrocytoma. The pilocytic astrocytoma, it is present with the history of children with the cystic lesions. So children with presence of cystic lesions as well as the enhancing nodules. To learn and grow daily like this, please do subscribe.